So I had one of my supervisors work last night. She already gave me a heads up. I am getting 3 admissions today, no discharges. So I'm already kind of anticipating what my day is going to be like, depending on if anybody is IV certified or not in the facility today. That'll tell me if I have to hang any IV antibiotics. I don't believe I'm having any discharge. I'm praying I don't have any hospital transfers. My goal is always to keep the resident in-house as much as possible, okay, because these affect your quality measures, which then correlate with your survey outcomes. So I do try to keep them in-house as much as I possibly can. Unless I truly can't manage them, then of course I'm going to, ship them. I'm going to have 3 admissions today, so that tells me that I'm going to be pretty busy. A lot of times they come back to back, and that's the one thing I do not like, because I want to be able to spend time reading over the information, making sure I don't miss anything, especially if they're like complicated. We do get some complicated cases, and a lot of times you don't get all that hospital information, and that is a big problem for me, because in order for me to make sure the resident gets the best care, I need to really know what happened with that resident. And a lot of times you can get an admission and you might just have a discharge summary, which might just state the orders, okay? Meaning you're guessing for diagnoses, which I don't like to do, because they can be on a medication for one thing, but it's actually treating something else. So I don't like guessing on, diagnoses for medications. It doesn't give me enough time to see the full picture of that resident in terms of what I need to make sure she has. So if I get an admission, if they need oxygen, or if they're on IV antibiotics, I just like to make sure that the room is set up. Like I said previously on the other video, enabler bars shouldn't be on the bed automatically. So, need to make sure that those are off, because we don't just want to apply enabler bars on them to residents who don't need them and who aren't evaluated by them for them. So if they need anything like oxygen or IV antibiotics, I want to make sure I have that information in there. I want to make sure I have their paperwork all together, so I'm not running back and forth. And that's what happens sometimes when I'm getting multiple admissions and they're coming back to back. I don't like to rush that process, because that's how mistakes happen. I like to take my time with my admissions to make sure that I'm really thoroughly going over everything. I don't want to go in there not knowing what I'm doing. I want to be able to really give my attention to that person. But when I'm getting 2, 3, 4 admissions in one day back to back, I'm not able to do that. And I will say that is one thing I do not like. But I understand that heads in the bed, you need it. You gotta, you have to make money. So I understand that part. But I just don't like the fact that they come so close together. All right, so I'll walk you through that process with the admission process. And I might actually put it in another video, because I do create tools for admission. So like if you are a nurse and you don't know what to do for admission, I have an admission tool that I utilize just to make sure I'm hitting all the points. Now, the facility that I'll provide services to, they have an admission checklist. So it's great. I don't have to think about anything. What I need to do is just right there. But majority of the time, I don't get all that information completed. And that's why nursing is 24 hours, meaning the next person would then pick up, or, at least that's how it should be. And then when you have that morning clinical on Monday, then that should be the closure of everything. Everything that happened over the weekend should be closed out during that morning clinical on Monday. So I'll just try to vlog as much as I can today and continue to follow me on my processes.